For Haitians, the HIV epidemic has been long, painful, and at times humiliating. At first, scientists thought the AIDS virus was brought to the U.S. from here. Haitians were put on a watch list of 4 H's, along with heroin users, hemophiliacs, and homosexuals. The erroneous label demolished Haiti's tourism industry. Political turmoil also drove out foreign investment, and today 2/3 of adult Haitians are unemployed. They've fled for the U.S. by the boatload and by the million to the capital, Port-au-Prince, creating slums like the one near the clinic Dr. John William Pop began 20 years ago.
The slum that you see here has been built on garbage. And we used to joke about it to say that by adding additional garbage, we'll reach Miami and we'll be able to walk instead of being boat people.
Although unfairly stigmatized, Haiti does have a serious AIDS problem, one that brought the Haitian-born Dr. Pap back from New York's Cornell University. HIV prevalence is just under 5%, 300,000 people. It's the highest in the hemisphere, but Dr. Pap says well below what it could be.
We are almost living on a time bomb. And we have all the factors that would predispose this country to have rates as high as 40–50%. Especially the disease started here early. It spread very fast in the heterosexual population. We have the highest rate of sexually transmitted diseases. We have also, we're the poorest country with a very high rate of commercial sex workers who are HIV infected. If you put all this together, this is the best recipe for an explosion of the HIV epidemic. Yet this had not occurred.
One reason it hasn't occurred is the work done in Dr. Pop's Gheskio Center and a rural project called Partners in Health. They've developed low-cost approaches to prevention, testing, and care. For example, controlling the incidence of sexually transmitted diseases, which increase the risk of HIV infection, and treating severe diarrhea. Their success recently earned Haiti an award of up to $67 million over the next 5 years from the UN's Global Fund for AIDS, Malaria, and Tuberculosis. It will greatly expand the public health effort and the availability of medicines. Haiti is the first developing nation in which antiretroviral drugs will be somewhat widely distributed. These so-called AIDS cocktail drugs have allowed patients in Western countries to lead almost normal lives. But they've long been considered just too expensive and not very feasible in poverty-stricken countries. Dr. Paul Farmer has long campaigned to change that thinking.
One of the biggest set of myths we're dealing about are about therapy for HIV. It can't be done in a place like this. People don't have other rights. They don't have a concept of time. They don't have wristwatches. The medications have to be refrigerated. It's not cost-effective. It's not anything you could ever initiate in a really poor country.
For 20 years, Dr. Farmer has divided his time between Harvard Medical School and the Zanme La Sante, or Partners in Health project he founded in Haiti's remote Central Plateau. Since the late 90s, when prices for some AIDS drugs began to decline, Partners in Health has provided antiviral medications to as many patients as it can. On a limited budget, the drugs are funded mostly by private donations, and like all services here, free to patients, most of whom could not afford them anyway.
I consider myself a second Lazarus.
41-year-old Sancour Francois was brought in 3 years ago. So close to death, his family had purchased a coffin. With drug therapy, he quickly recovered and has had almost no health problems. Life is still a struggle. Francois cannot find employment. His wife and 2 daughters moved temporarily to Port-au-Prince to find work. But he's thankful for the chance to see his children grow up.
After God, I am most thankful to Dr. Paul. My weight was 95 pounds. I'm up to 142 now. The medications have done so much for me. In Haiti, certainly those in Port-au-Prince knew these medicines existed, but their price was so exaggerated. But here, patients don't pay anything for the medications.
One unanticipated benefit of bringing antiretroviral therapy to rural Haiti is that many more people are coming into clinics to be tested for the AIDS virus. For the first time, doctors say, people have been able to witness AIDS patients, people dying of AIDS, get better.
and suddenly you have treatment and a lot more people want to be screened, you're going to get a lot more people who are negative, who are seronegative. That is, they don't have HIV, and that's where you can start making interventions to keep them from getting HIV.
There are other benefits as well, even for those who don't receive the limited supply of drugs. They can be treated for opportunistic infections, which kill thousands of AIDS patients in poor countries. Tuberculosis is rampant in Haiti, for example, yet easily treated for just a few cents per patient.
Ketia, ¿cómo ella?
19-year-old Ketia, who's HIV positive, lost her mother and 2 siblings to tuberculosis. She now lives with her father. Both have been treated for TB. To ensure medicines get to patients like Ketia, who are too poor and too far away from the clinic, volunteers like Estanie Dionville are recruited to visit patients every day. Some days a doctor comes along, like David Walton, a recent Harvard Medical School graduate. Ketia may need AIDS drugs later, he says, but for the moment she needs money. The small plot they farm cannot cover rent on their tiny home or the fees to help Ketia finish school. Partners in Health will provide the money, an investment in AIDS prevention.
If she didn't have money to pay the house and she didn't go back to school, she'd have to do something to put food on the table and to help her father. And that may entail maybe going to Port-au-Prince or choosing a partner who can give her some kind of financial assistance.
Paul Farmer called it survival sex yesterday.
That's a perfect term for it. Perfect. Survival sex. She'd have to have sex with this person to survive. And this person would likely have other partners. And so she'd be exposed again. And then if he wasn't sick, she'd be exposing him. So, I mean, this is the way in which we epidemiologically can kind of step in and stop the progression and the spread of disease.
But Haiti has numerous other hurdles that hinder public health. Poor roads means it takes too long to get medical care.
Bonjour, Isaac.
Isaac was brought in too late, suffering from typhoid, a common waterborne killer in a country where 80% lack safe drinking water.
I don't think he's going to make it.
3 days after we visited, Isaac died at age 10. Dr. Farmer says Haiti desperately needs roads and water treatment plants. While grateful for the AIDS grants, he's critical of the U.S. government, which has blocked international loans to the Haitian government for such projects.
You'd have to be unable to connect the dots if you didn't think that obstructing water aid to Haiti was related to the fate of a child like that.
U.S. officials agree more money is needed for Haiti, but say the assistance is best channeled through non-government organizations. Some in this American congressional group which recently visited charged the government of John Bertrand Aristide with corruption and election irregularities, charges President Aristide denies. However, even Aristide's harshest critics praise the government for its strong support of AIDS programs.
We congratulated Mrs. Aristide and President Aristide this morning for the award from the World Fund on AIDS.
Despite the political impasse and all the economic hurdles, Dr. Papp says AIDS programs have continued and will get a major boost from the Global Fund dollars. At clinic level, pediatrics colleague Dr. Francine Noel says the new money will mean some relief from the wrenching decisions they've been forced to make, like rationing the limited antiviral drugs to just babies and not their mothers.
One of the mothers actually told me that if she could take some of the drugs of her child herself.
She wanted to take
it. She wanted to break a piece and take it herself. And we had to explain to her and make sure that she was not taking the drug of her child.
Global Fund dollars will provide more mothers with antiviral drugs, but ironically, most of the money will go toward uncovering yet more need. 25 new testing and counseling centers will be opened across the country. Haiti's First Lady, Mildred Aristide, who oversees the government's AIDS efforts, says many more people will get HIV tests, which could greatly help in prevention.
So I think the most important tool that the Global Fund project brings is this capacity, because then Haitians, and women specifically, because the women, in my estimation, have been the most vocal in wanting to know their status, could be active agents of prevention, information, education, passing that on to their children, but they need to know. And right now, we don't have the capacity for for folks to be able to be tested.
Dr. Pop's goal is to reduce Haiti's HIV prevalence by a half. That won't eliminate the epidemic, but he says it could bring it under control.
We used to say that only the optimist people have stayed in Haiti, so you're talking to an optimist person.
Experts share that optimism and say it could translate to hope for many developing countries ravaged by AIDS.